Well, aloha and good morning to all of you watching here on the Honolulu Star Advertiser platforms for the COVID-19 care conversation. It is a beautiful Wednesday here in Honolulu. I'm Ryan Kalesuji.
And I'm Yanji Denise. Thank you so much for joining us. This, of course, is a conversation designed to bring you resources and get answers for you as we continue to face the coronavirus here in the islands. It is brought to you by the Hawaii Executive Collaborative and Hawaii Pacific Health. They are our partners in this project, along with the Honolulu Star Advertiser. And so we thank all of them for making this possible. Send us your questions. Let us know where you're watching from this morning, and tell us how you're doing. We know that it's been a long 2 months already, Ryan, and there's more to come. But one of the things that the state has done is allow for elective medical procedures to start up again. And so a lot of people have disengaged with their doctors, and it's really time for people to reconnect. But there is some trepidation. People are a little bit concerned about going to the hospital, going into a doctor's office because of concerns about COVID-19. So we have invited a doctor to join us today to talk about what you can expect and how you can safely engage with your medical provider, because we don't want those conversations to stop.
That's right. Dr. James Barahal will be with us in just moments to talk a little bit more about some of the things that are happening within the hospitals of the Hawaii Pacific Health and how they are making sure that everything is safe there, but also talk about some of those other maybe elective surgeries that have sort of been put on hold and some other things that we are seeing in hospitals throughout the state as we sort of move beyond some of the COVID-19 rush that was sort of in the midst there, and a lot of things got put on hold. And as hospitals sort of resume and other care begins coming in, so we want to make sure that all of you who have any questions about this can type your questions in for the doctor. Again, we'll be talking to him in just a little bit.
And we see Mindy already asking a question about masks. We will be sure to ask that. So Mindy, we'll get to that question as soon as the doctor joins us. And the rest of you, please start to type in your questions, because we definitely want this to be a conversation, a back and forth. Before we get to the doctor, though, we always like to start with the count. And Ryan, again, good news yesterday.
Yeah, just one new case for a total of 635 positive cases through the state. Now, this new case was actually an out-of-state resident who was screened at the airport and tested positive later. So showing that the screening at the airport, for some degree, is working. They were able to find this person there. Again, only 17 deaths, so no new deaths have been reported for about a week now, or a little over a week. And again, in the single digits for over 3 weeks. So those numbers continue to stay low, and the curve continues to be flattened.
Yeah, and that distinction is really important, that this person is an out-of-state Hawaii resident. That likely means, we don't know obviously the travel history, the case history of this individual, but it likely means that they contracted the virus outside of the state of Hawaii. That is good news, of course, because that means there is less community spread. So even though you do see that one new case, which is one case too many, it is still reassuring to see that we're not, that person wasn't necessarily found here in Hawaii. So we like to see that. Lawmakers are back in session. They are working on trying to, stop that major budget hole that we have now, thanks to a huge reduction in the tax base. And so they are continuing to battle over the budget. One of the things, the members of the Finance Committee yesterday met, and they're trying to figure out how $1.25 billion in federal CARES Act funding will be distributed. The paper's got a great write-up on the back and forth there. And we've actually got some lawmakers who are joining us on Friday to talk about this in more detail.
That's right. Representative Kai Yamashita and Senator Gail Keith Agaran will be here on Friday to talk a little bit more about that budget and how to kind of fill that gap. And we're also hearing from HIPAA about the unveiling of a color-coded system that will be, hopefully, they say, released later this week. The governor currently reviewing it. We heard from the governor on Monday, who talked about some of those efforts that will be happening, and that announcement that will likely be coming out this week. So we look forward to keeping you posted on what that exactly looks like as Hawaii begins to reopen for business. So a lot of news coming in.
Yeah, and I see here Romeo asking, should retailers disinfect clothes before they go back on the rack after they've been tried on? Romeo, Ryan and I have actually been talking about this off camera. I have the same question as to how it's going to work when you go into shop. Obviously, items can be disinfected if you touch them, but can you try clothes back on? We've invited some members of the Hawaii retail industry to come talk to us about how they're going to be handling this. So we hope to answer questions like that in the coming weeks. But in the meantime, I think that color-coded system for the recovery plan will help, and we're getting increased guidance from lawmakers as we try to navigate this post-COVID world.
That's right. And again, it's sort of in phases here. And one of the first things that were allowed in this reopening of Hawaii was elective surgeries and some of these other medical procedures that were allowed. And joining us now from Hawaii Pacific Health is Dr. James Barahal, joining us this morning. Thank you so much, Doctor, for being here and joining us here on the COVID-19 care conversation. First question for you, how have things sort of adjusted and changed for the hospitals now that the curve is flattening? What are some of the steps that have happened since elective surgeries and other procedures have been allowed?
Right. Obviously, as you mentioned, now that elective surgeries and other procedures are being allowed, there's more happening at the hospital. But still, it's a slow reopening. The clinics are not at full speed yet. And it can still be a little bit difficult for patients to get an appointment at the clinic. That's one of the reasons that we started this virtual urgent care, as we call it. The idea being Straub had and Hawaii Pacific Health had a very robust telemedicine system set up, but it was primarily appointment based. And so we took a look at the environment with COVID and realized it was going to be difficult for people to get in right away. So we worked on developing a system that I've actually been working on for about 3 years that would enable a virtual urgent care, meaning you're seen right away. And it had several things that had to be in place to do that besides the technology. We think it's very important that people see a local physician, and in this case, a Straub physician. So this system is set up right now where you can call a number and immediately see a Straub physician. And this has enabled people to get access to the healthcare system that's become difficult, number one, just logistically because of the stay at home and the reduced capacity because the hospitals had to be prepared for the surge. But also people are afraid to go out of the house. So we felt that this virtual urgent care could be very helpful and necessary, and it's proven to be just that.
Of the patients who are calling you and engaging in telemedicine, I know a lot of folks are doing that for the first time. I've never done that. How many of the cases can be resolved, via telemedicine? How many cases actually need to come into your office?
We've done several hundred cases already. I personally have done several hundred myself. Most of them can be resolved without coming into the office. I would say 90%. Those would be the simpler things. Many prescription refills, for example. People are running out of medicines right and left. I can't tell you how many people I've seen that have run out of blood pressure medicine, diabetes medicine, important medication. And we're not talking about they ran out yesterday. We're talking about people that ran out 2 weeks ago. So we see a lot of simple stuff. So most of it can be resolved. Sometimes the resolution is to bring them into a clinic or a hospital. And this is also proven to be daunting in some ways. People don't want to go to the emergency room. So one of the things that we do is we evaluate the case, and even if we can't treat it, one of our mottos on this is we can see everybody, but we can't treat everybody via telemedicine. But everybody can be seen. And in some situations, we do tell them, you need to go to the hospital, you need to go to this clinic. And then we expedite that. We move through the system and get people the care we need. So it's a combination of expediting and treating and or moving, triaging, moving somebody to the proper place, because people really don't want to go to a healthcare facility right now.
Benita Brazer has a question, which I think we can answer her question and also sort of widen it out. She says, I have a dentist appointment at the end of the month. Is there anything I should know? I think a lot of people, if they do have to come in, and obviously, a dental appointment, you probably can't do that over telemedicine. If you actually do have to go into a healthcare setting, what are some things that you should know? How should you prepare yourself?
Well, I think as long as you know your provider and they're following the appropriate guidelines, and they are reopening, I think there's not too much to worry about. So I would follow those guidelines. I actually have seen several dental cases, believe it or not. I've actually seen a couple cases that have been referred by dentists in which we clearly have an abscess or some intraoral situation that's going on, and we're able to help it along by prescribing antibiotics so it can quiet down so the dentist can see it. So we actually do see some dental stuff. But it's interesting with the virtual urgent care telemedicine. Historically, telemedicine is about 70% behavioral. If you look back a year ago and you look at where telemedicine was, it was 70% behavioral. Because therapy, psychotherapy, counseling, you're just talking to somebody. It doesn't involve any physical diagnostic capability. But now, of course, it's shifted dramatically. And one thing that we have noticed doing this, and I know this has been discussed, is a concern on the other side of this that many serious illnesses are not being seen or treated during the COVID epidemic, which could create some healthcare problems down the road. I made a little list of the things that I have seen personally in telemedicine in the last month, and it might surprise you. I've seen new onset pancreatic cancer. I've seen several heart attacks. I've seen strokes. I've seen perforated appendix. I've seen sepsis several times. I've seen diabetic ketoacidosis. I've seen urinary obstruction with renal failure. So the notion that telemedicine, yes, it's very easy to treat a rash and a minor condition, but we're seeing very serious conditions out in the community that in many cases have been sitting there day after day. I saw a lady yesterday who's had a urinary tract infection for 14 days. That's kind of unheard of before. Most people don't usually wait that long. So I think one of the messages that we at Hawaii Pacific Health want to get out now is we are open and don't wait. And if you can't get in to see your doctor or into the clinic, then use our telemedicine because we'll steer you in the right direction. If we can treat you virtually, we're going to do that. But if we think you need more care in person, we will get you to the right place. So I think that's an important message today. This has been going on for a while, the stay at home, longer than I think many people anticipated when it started. And these other diseases have not taken a holiday. Heart disease, cancer, some of these surgical emergencies that we've seen are because people waited. Incarcerated hernia, I saw. So these are the kind of things that normally are diagnosed quicker in the office and then they don't become surgical emergencies. So, we understand why people are waiting, but we want people to know that we're here. Within 5 minutes, you can see me, and don't let these things wait, and make sure you get your medicines. Take care of yourself here.
Yeah, definitely an important message because some of those things that you were sort of listing off aren't just a common cold. I mean, those are very serious things that need to be addressed.
Yeah, you wouldn't expect that in telemedicine, and I'm not trying to scare people, but having developed telemedicine systems now over the last 3 years, I was not expecting to see that. Heart attacks, sepsis in particular, which is a systemic infection that gets into the bloodstream, which is life-threatening, and usually starts with fairly benign infections. It can start with a leg ulcer. It can start with a urinary infection, especially in older people. These things can get out of control pretty quickly, and I've seen several people just who are bedridden who clearly have sepsis. So again, we're running the gamut. Most of it is routine, but some of it isn't. So we want to make sure people know that help is available. Don't sit on this stuff too long.
One of the first questions that came in, sorry, Angie, is the debate over masks and whether or not people should be wearing masks or not, and when and how. Mindy, one of the first comments that came in are asking about why healthy people are asked to wear masks. She's saying that research says that healthy people should not wear masks. So do we wear masks until the vaccine that might not work? Just asking for clarification and if we have to potentially be wearing masks forever.
Well, I'm not Dr. Fauci, and I'm not in the Department of Health, but the reason why you would wear a mask as a healthy person is because maybe you don't know if you're a carrier or could possibly transmit it. So it's to protect other people. And you may be around people who have, immune suppression, other kind of illnesses. So I think until we get a better handle on this, I think the mask issue, I think that's a pretty small price to pay. I mean, I'm not unaware why some people feel that way. It's uncomfortable. I understand even the civil liberties side of this thing, but I think from a healthcare point of view, I think that's appropriate and necessary right now. And as far as, are we going to have to do this till we get a vaccine? That's a policy question that, I probably can't answer right now. And I think one of the messages I'm sending today is let's not look that far out into the future. I think we all have to take this a little bit day by day. One thing I've been saying in this whole situation is every day is like a week. Every week is like a month. Our knowledge changes, situations change. Yes, wear a mask. And hopefully, like I said, things can change quickly. But the main message here is although we don't read much about it, these other serious health issues, cardiac disease, diabetes, cancer, there's a concern here on the healthcare community about what's waiting for us on the other side of this, because a delayed diagnosis of cancer, delayed treatment of cancer can have terrible repercussions, obviously for the person who has it, but for society at large. So that's why we set up the system. We needed to find a way to get people into the healthcare system immediately. And I think we've been successful at that.
John Williams Waddell has a question about security. He says telemedical sessions are not generally secure. What's happened to HIPAA? So there's a question, a lot of people might not feel comfortable doing telemedicine because they worry that someone might be able to access that information. Can you address that concern?
Yeah, that's a great question. We actually, Hawaii Pacific Health, of course, as a large healthcare facility, we have a lot of resources, and we are on a HIPAA compliant platform. Our telemedicine visits are done on a HIPAA compliant platform. We do use FaceTime in the rarest of situations. Sometimes we encounter technical obstacles, generally on the patient end, and FaceTime is easier for some people. So in a rare situation, if I feel I really need to touch base with this person and I can't get them on the platform, although trust me, this is really easy how we do this. Basically, you click a link and you click a button and we're seeing each other. But occasionally FaceTime, but 98% is on a HIPAA compliant platform, so not to worry.
Moving forward, how much do you think this is going to be the way medicine is practiced? As obviously it's going to be a while till we get a vaccine. Do you think that this is really the way that medicine is going?
Yeah, that's a really good question. I think that when you're in the middle of it, it's easy to think this is the future, the new normal. So, we'll see, because habits are hard to break. And I think that there'll be a bigger role. As I said, historically, telemedicine, 70% behavioral, not so much what we're doing. But I do think if you make it easy, which we're doing, and you make it skilled, which is what we're doing, because you're getting a Straub physician on this one. Some of the other platforms, a lot of mainland physicians, which I think in this situation is tricky, because you need to be able to navigate the landscape in this situation. We need to know where to get somebody a COVID test or an antibody test. We need to know which clinic is open, which clinic isn't, which pharmacy is open, which pharmacy isn't. So I think it's important that it's a locally based system. We make it easy. We make it skilled in the way that we kind of know our limitations, but we are able to do a lot. And I think if you keep that quality level and make it really easy, and by the way, when I first started working on telemedicine platforms 3 years ago, the biggest difference is the technology is so much improved. So a lot of what we're doing now, we couldn't have done 3 years ago, just because the technology, the smartphones, the internet, the bandwidth, things are so much better. So I would think if 5 years from now, we're going to be doing things in telemedicine that would seem unimaginable right now. It's a long answer, but I do think it will carve out a niche and play a much more significant role.
This is a question that we have heard a few times and heard a few different explanations. We want to get your take. Is there a seasonal effect associated with COVID-19 transmission? And will this translate into Hawaii, with some officials saying that the COVID-19 will sort of die down in the summer months and have a surge back in the fall? How does that translate to a warm weather place like Hawaii?
Well, again, I'm not an epidemiologist or an infectious disease specialist. I am a physician. Obviously, it's a coronavirus. It's a new one, but I think it does adhere to certain principles. And I would expect a seasonality to it, and expect it is decreasing right now. I think that's multifactorial. Some of it are the efforts that everybody's making, the great leadership that we're having, the cooperation of the people. Some of it's that the flu dies down this time of year. Hard to know which is which, but that's a good thing. And I think when people talk about the second surge, if that were to come, I think that's partially based on the seasonality that we would expect as the flu season, which historically begins in the fall, doesn't usually pick up steam more into the winter, that if there were to be a second wave, and let's hope not, that would have some seasonality component. But I think we can take advantage of the seasonality of it now and hopefully we can eradicate this thing now.
Zylstra Poloi, I hope I'm pronouncing your name correctly, says, with the supply and demand issues we're seeing, including medicines and such, is there a timeline for manufacturers and distributors on when supplies will be available and distributed? We saw toilet paper flying off the shelves. It's hard to find Clorox wipes, things like that. How is that translating when it comes to medical supplies? Is there enough of the pharmaceuticals, those kinds of things, to address his question?
In the sense of some surge, do you think the question is referring to that?
Right. No, it says here, I assume when tourism opens up in Hawaii, we'll be bombarded with visitors. I'm worried we won't have enough necessities, including over-the-counter medicines for everyone. Are you seeing any shortages?
No, I'm not. Of course, I founded Doctors on Call, which is not part of Hawaii Pacific Health, also Doctors on Call Maui. So we have large tourist practices. Our practices historically have been a combination of residents and visitors. So right now there are essentially no visitors. So I think there's going to be a role for clinics like ours when tourism returns. I think we're going to hopefully move more toward a system that we have done with the flu over the years. We see a lot of flu from different countries. And in order for people to fly back where they came from, they often require a negative flu test or an absence of fever for 24 hours. So we've done literally tens of thousands of rapid flu tests over the years. And I think at some point, that's probably what's going to happen here, is that the visitors, when they come, if they exhibit symptoms or fever, will get a rapid COVID test in order to travel back. And if they test positive, we'll have to undergo some sort of quarantine. That's not really new. That's something we've been doing with travelers for the flu for a long time. What is different about this one is that the quarantine is quite a bit longer, and the lethality or the danger of this virus seems to be a step above what we're used to. But the system itself and the way we quarantine and test people, and actually, being a clinic in Waikiki, we see a lot of stuff that people are not familiar with. Things like chickenpox, measles, stuff that's been largely non-existent. Although, without getting into a long vaccine discussion, is coming back. So I think eventually we're going to go to that kind of system, and I expect us to be on the front line of making sure that it's safe for tourism to come back, making sure that not only are the visitors safe, but that the local people are not being exposed unnecessarily to these kinds of things. So I think we're going to see similar to what we've done for years, but with some added steps.
All right, our time is sort of winding down here, but I just wanted to give you one more opportunity to sort of announce it, or make aware to those who are tuning in. For those people who may be experiencing something that they're thinking, maybe I should go in there and get a telemedicine appointment made. What are sort of the steps? What should they do? Where should they go to sort of get that process started?
Well, the easiest way is to call Doctors on Call, which is 808-971-6000, or you could call Straub, the central number, at 808-522-4000. This system, the entry into the system is interesting for telemedicine. It's not app-based. We realized when we set this up that even the downloading and the using of an app can be daunting for some people. So when we create a virtual urgent care, what we do is we look at what happens if it's a non-virtual urgent care. In other words, you walk into a clinic. So that's the process when we look at what are we trying to do here? What would happen to you if you walked into a clinic? What would you encounter? And we try to recreate those steps with a virtual urgent care. So you call and talk to a person, not a bot. You don't check yourself in. We check you in. It takes a couple minutes. The doctor is notified, who then electronically sends you an invitation, and you're seen within a couple minutes. So it's so simple. It's almost hard to believe. And so what I would say is, don't let these things wait. I've seen too many things in the last 6 weeks that could have been handled with a simple prescription that have turned into life-threatening. Again, that's not the majority. I'm not trying to play the scare game here, but most of it's simple. But trust us. Let us be the judge. We're Straub physicians. We're part of the community. And if you need additional help, we're gonna expedite that. We're gonna get that to the right facility at the right time. And let's make sure that lost and all the other stuff that you're letting something a health problem that could easily be taken care of turned into something serious.
All right, Dr. James Barahal, thank you so much from Hawaii Pacific Health for joining us this morning to share a little bit more about telemedicine. Great insights, and again, thank you for all that you're doing in this effort.
Thank you. Stay safe.
Aloha.
Thank you. Wow, very interesting to hear, because he's right. When you think of telemedicine, you really do think of talk therapy happening online, or maybe, you know, I've got a rash, what is this, right? But for him to say that he's been diagnosing cancers and, you know, other heart attacks and other very serious illnesses, and don't sleep on these issues that, you know, we've been so fixated on COVID and not wanting to interact with, you know, medicine if you don't absolutely need to, but now is the time really to reconnect with your doctor and to make sure that those small issues don't turn into big ones.
Yeah, and I think it's an easy way for people to sort of get that testing. And again, if there's more screening needed, as you say, there are additional steps that could be happening, but just having that initial conversation, I think, will be important. So again, we will have more information in our notes section about these virtual clinics and ways where you can get connected. For those who are out there who may feel like they need to get something checked out, we'll provide that information out there as well. So thank you to the doctor for joining us again this morning.
We also want to talk to you about a few other issues that were brought up in the paper that were very interesting to us. $25 million announced in a grant program by Mayor Kirk Caldwell for the city and county of Honolulu that they'll be giving out to help businesses as they reopen sort of gear up for a post-COVID environment. So that could mean you know, barriers in their stores or anything that they need to make their environment, their retail environment safe. This is for smaller businesses with fewer than 30 employees. They'll be eligible for grants of up to $10,000 to reimburse them for those, you know, practical things. Who knew that you needed all this plexiglass? So that application process starts on Monday, and the paper has a really great write-through on who's eligible and how to apply.
That's right. And another story and another thing that people are looking forward to is the opening of malls and retail establishments here on the island of Oahu. That's happening on Friday. We know that some of the neighbor islands have already begun opening up some of those retail shops. We talked a little bit about that earlier, about some of the things that are going to be allowed and not allowed. Well, looks like we're going to get some answers on Friday as this opens up. And it's going to be interesting to see how many people sort of go into these stores and these malls. We know a lot of these retailers are excited to sort of open their doors and allow people back in. There are announcements coming out from Ala Moana Center, Pearl Ridge, as well as some of the other major malls here on the island of Oahu, of the steps that they're taking. And so, you know, we encourage you, again, head over to the paper. There's sort of a listing of some of the requirements that each of these establishments are now mandating for some of the customers that are coming in. So another resource that is there to kind of inform you about some of the things that will be happening on Friday with the reopening of these retail establishments.
Of course, we always like to highlight a hero of the day, and today we want to mahalo First Hawaiian Bank and its Aloha for Hawaii campaign. Part of that initiative that the First Hawaiian Bank has made is a $175,000 donation to Child and Family Services. You can see there the campaign that they're doing. They've launched the organization's Festival for Hope for Families. It's a one-day drive-through festival supporting 750 Leeward families through providing meals and PPE services support. It also allows Child and Family Services to continue to offer programs statewide for those impacted by COVID. In addition to that, they've also donated $100,000 to Aloha Harvest, which has been distributing food to communities in need. So that's amazing to see. And to date, First Hawaiian Bank has actually contributed $450,000 to various nonprofit organizations since their Aloha for Hawaii campaign began in mid-April. And remember, you know, if you happen to have one of their First Hawaiian Bank cards, $1 for every takeout and delivery order placed on those cards went towards that donation. Their eventual goal, generating $1 million in takeout or delivery purchases at restaurants across Hawaii. And overall, they plan to donate $1 million to nonprofits. So an amazing initiative there. Wonderful to see First Hawaiian Bank really step up and help our community.
That's right. And again, we encourage you, if you have a Hawaii hero that you would like to highlight, we encourage you to add that to the notes. We are always looking to tell some good stories in these times. We know that there are a lot of scary things happening, that sometimes some negative news that comes out that can get people a little down, but it's great to highlight the wonderful things that are happening right here at home. So I encourage you to let us know who you think should be a Hawaii hero.
One of the people that's been most popular on this program and generated a lot of questions is Dr. Christina Kishimoto. She is joining us tomorrow. So if you know any parents, if you happen to be a parent and you are interested in finding out what is happening with our public school system, please join us tomorrow. Of course, it's graduation season. That has changed dramatically, but what's happening for summer school and how are they gearing up for fall? We're going to be addressing all of that tomorrow with Dr. Kishimoto.
And then again, on Friday, we'll be talking to members of the Hawaii State Legislature to talk a little bit more about some of the efforts that are being made right now in session with Representative Kyle Yamashita and Senator Gail Keith Agaran, who will be kind of diving deep into the overall budget and some of the efforts that are being made to fill that gap. And if there are going to be any potential cuts to services, we know that there was an announcement made from the governor yesterday saying that they will not be looking at reducing in salaries. We know that that was a hot topic for some of the teachers, that there were talks that teachers would see that 20% cut, but the governor's saying that they found a way and that there is enough money with the CARES Act coming in. So that is something that they're not looking to do, but there could potentially be other projects that have been greenlit that might have to be put on hold. So we'll talk a little bit more with the senator and representative about those efforts and about the things that we could expect to see with the legislature as they continue to sort of navigate through this time during this special session.
Yes, so that's right, Mindy. We'll join you right back here, same time tomorrow, every weekday, 10:30, right here on the Facebook page of the Honolulu Star Advertiser. Thanks again to Hawaii Pacific Health and to the Hawaii Executive Collaborative for making this all possible. Thank you for joining us and for sending us your questions. We'll see you right back here tomorrow, 10:30, with Dr. Christina Kishimoto.
Aloha.